Okay, we're ready to get started. Yes, thank you, you guys, for being here today. There's a lot of other places you could have been on a Wednesday at 6 o'clock, but you chose to be here and talk about drugs. So I think I thank you guys for that. My name is Veronica Wright, and I'm founder of the National Coalition for Drug Legalization. The mission of this nonprofit is to advance the conversation about drug legalization through community service and research. And I see these public forums as community service, as a way to reach out to the public and, get you guys' thoughts on what, how you feel about the legalization of all drugs. But I do want to share with you a quick story before I go to SSDP. I was someone who did not support not even the legalization of marijuana as late as 2017. But then my cousin Dwayne passed away, and he was someone who was born drug dependent. He went to prison for drugs, and he died an alcoholic. And at his funeral, I met his son for the first time. And when I met Desmond, there was no question that that was Dwayne's son. I mean, he looked like Dwayne right down to his fingertips. And I made Desmond make a promise. I said, if you graduate from high school, you can come live with me, provided that you go to school and you work. And Desmond kept his end of the bargain. He graduated from high school, which was something that his daddy didn't do. His dad dropped out in 12th grade. And when he came to live with me, he was 19, and it was hard. And I don't have kids, so I treated him like the son I never had. And I found myself turned into mama bear. I was like, did you turn in your assignments? Let me see your grades. I was online with the professors trying to get them to give him extra credit so that he could get through their class. I was telling him, wash your clothes, take a bath, brush your teeth. Things that mama says, right? I was mama bear. Eventually, he decided he didn't want to do school anymore. School was difficult for him. Um, so the good thing about all of this is now he, has a job. He's going to be working for the Newport News shipyard, and he's going to be living on his own. And I'll be there to assist him. But while I was going through all of that, being mama bear, I couldn't help but think about, why I'm going through this. Why couldn't Dwayne be here, his dad, to see his son graduate from high school? Why couldn't he be the one, to be more of an influence in his life? When Dwayne went to prison for drugs, he had the felony on his record, and the trajectory of his life just went down, just went downhill. And you guys know the story. When you have a felony on your record, you can't qualify for any type of federal assistance. And we're a family of humble means, so we did all we could for him. And he was totally dependent on us till the day he died. But when you get that felony on your record, you can't get housing, you can't get food stamps, you can't get Pell Grants. And when you're coming out of prison, and if you don't have any money, those are the people that need federal assistance. So that's when this drug situation started to really change for me, and I began to support the legalization of all drugs. It's just having that experience with my cousin, and then taking on his son and trying to take care of his son, because Desmond is Dwayne's legacy. So um, today is going to be informal, a sacred, organic space where we can say what we want to say, even though it's recorded. And, we're just, I'm just so thankful that you guys are here, and I hope more trickle in. Thank you to all the people who are online today listening to us. I really appreciate that. And now I'll hand this off to SSDP.
Thank you, and thanks everyone for being here. My name is Robert Hoffman. I am the Policy and Advocacy Director for Students for Sensible Drug Policy, working out of our DC office. So Students for Sensible Drug Policy, as I'm sure many of you know in this room already, is an international organization of young people working to end the war on drugs, and that includes all drugs. So working on things like drug decriminalization at the moment, we have a model resolution to advance sensible drug policy that is pushing for essentially as close to drug decriminalization as you can get at the local level in about 8 localities at the moment, and potentially 1 county in Colorado, which might be coming up. Very exciting stuff. But I'll make this quick. I want to have the chapter be able to discuss a little bit, but I just want to talk a little bit in terms of drug policy, where we are right now and where we need to go. I think one of the things that SSDP has focused on, and well deservedly, has been drug decriminalization. I think obviously the criminalization of all drugs, including and especially the most highly stigmatized substances, is really the crux of the war on drugs, and that's where we're going to need to strike in order to dismantle this corrupt institution. So today, though, I want to discuss, and I'm glad that Veronica and other people have been discussing this idea, because I was on a call with Drug Policy Alliance the other day, and our partners at the Parabola Center, which is a new policy center that has Shalene title on it as an example, working to discuss things like drug regulation, because this is something that has not been really properly explored. I know there was one policy proposal sent out by, I think, Transform Drugs Foundation in the UK, and maybe some other organizations, but we really don't have the models or some of the models for basically legalizing, maybe re-legalizing some of these more stigmatized substances. So I would just like to thank everyone for attending today. I see we have one of our speakers coming up, so thank you, Dr. Hart, for attending. And feel free to sit up there if you'd like. You can get another chair if needed. And then, yeah, I will just pass it off to the chapter. Would just like to encourage everyone here to donate to ssdp.org/donate. We definitely need your financial support at the moment. And without SSDP, I think a lot of these campaigns wouldn't happen. Actually, the Measure 109 and Measure 110 campaign managers in Oregon for the first past state drug decrim were both SSDP. So yes, consider donating. I'll pass it off to the chapter.
Hi, everyone. My name is Avery Meyer. I'm a master's student here at Johns Hopkins Bloomberg School of Public Health, and I'm also the co-founder and co-president of the Johns Hopkins chapter of Students for Sensible Drug Policy.
Hello, my name is Emma Landry, and I'm an undergrad at Johns Hopkins University studying neuroscience, and I am the other co-founder and co-president of the SSDP chapter here at Hopkins and part of the board of directors of SSDP.
So we want to thank everybody so much for being here tonight. It's really incredible to see so many people in attendance. I know a month ago we were looking at like 20 people, so it's astounding to see all of these people turn out, especially to hear our absolutely fantastic panelists talk about this really important issue. Before we get started with the panel, we would just like to highlight some things that our chapter has been able to do this year. So the chapter started just this October, and kind of since starting that, Em and I have really been trying to engage with the Hopkins community at large, but also Baltimore City and the DMV area, and also Maryland policy. So we just wanted to share, recently we hosted a collaborating event with NeuroSci, which is an undergraduate club at Hopkins, and we talked about drugs and the brain, and kind of tried to do some myth busting, some re-education, especially with neuroscience students, like they can understand this stuff, went through some of the science, and challenge some myths, like you can overdose on fentanyl by touching it, can't happen. So just kind of those kinds of things we look forward to continuing to engaging with the university community to try to address some of these myths and have a better educated student body on drugs.
And within the Baltimore community itself, we have also worked with the Maryland Cannabis Policy Coalition and submitted written testimony to the Maryland legislator on HB 0837, which has passed since allowing marijuana legalization to become a ballot initiative. We hope to continue our engagement with the community and welcome anyone seeking support on policy change to be in contact with us.
And lastly, we just want to say that we're really trying to build a strong membership for our chapter here. So if you're at all interested in joining our chapter and our movement, helping us writing these testimonies and supporting the community as things come up, please email us and get in touch with us. Our email is ssdp@jh.edu, pretty simple, and we're happy to talk to you after the panel too if you'd like to get that information. And we're going to go ahead and hand it off to Veronica for a brief introduction for the panelists and get started. Thank you so much.
Okay, so the first person I would like to introduce is Billy Murphy, lawyer with Murphy, Falcon and Murphy. Sitting right next to him is Dr. Saba Rouhani. She's a professor here at the School of Public Health, and she teaches and she studies drug policy. Sitting next to her is Dr. Carl Hart, professor at Columbia University, neuroscientist and author of Drug Use for Grownups. Next to him, Jacob Rich, the Reason Foundation public policy analyst there. Mikey G, consultant with Urban Survivors Union. And on the end there, Dr. Sherman, she's also a professor here, and she studies the health of marginalized people and drug policy. Okay, so we're going to next start going into, before I jump into the questions, I want each of you guys to just, set the stage.
Who should go first?
I think you should go first, Billy. Well, what's wrong with,
Oh, we can do an introductory remarks?
yeah. So we're going to,
All right, my name is Billy Murphy. I'll go last. It's actually
Okay.
William H. Murphy Jr., but since birth I've been Billy, I prefer it. I've been involved in drug policy and actually representing people who have been charged with drug offenses, both felonies and misdemeanors, dealers and users, kingpins, you name it, I've done it. I started in 1970. It was my first year of private practice. By the end of that decade, I probably had more drug cases on the docket than anybody else. And it was a horrible, horrible experience. Tempered only by the fact that I enjoy winning. And the way we prosecuted people back then was just ugly. And the assumptions that we made about people back then and about drug use back then were so ill-informed and so devilishly bad that we got mass incarceration out of it. Richard Nixon started it, Ronald Reagan ratcheted it up fourfold, Bill Clinton ratcheted it up about threefold. And we're still stuck with the policies that are based on this so-called war on drugs. Now, the context of this is that the Black community was emerging as a political power. The neighborhoods were drug-free. I grew up in Cherry Hill. Some of you may not know where that is, but it's at the southernmost part of Baltimore. It's right on the other side of the Patapsco River, where the new development is scheduled to be open. It's right near the hospital down there, Harbor Hospital. It's a 15,000 unit project. And I grew up in the projects, and we didn't have drug problem back then. We didn't have violence. We didn't have guns. It was an occasional knife, but most disputes were settled by a fist fight, good old fashioned fist fight. And we all lived in real harmony. It was a real up and coming community. Everyone took care of their property. Everyone was upwardly mobile. Everyone wanted to graduate from Cherry Hill into a non-subsidized way of life. Suddenly, in the early 70s, all of that changed. Drugs suddenly appeared in the Black community. Heroin was the first, but then came crack cocaine. Now, we've never been in the drug importation business, except with one notable exception. And when I say we, I mean Black people. During the Vietnam War, there was an extensive importation operation going on because of the GI's exposure to heroin, exposure to selling heroin, exposure to using heroin, exposure to addiction to heroin. And so a lot of people started importing heroin from Vietnam and from the Golden Triangle. The Nigerians got involved. They were hugely successful. They were more successful than the mafia. All kinds of intricate ways of importing drugs were developed. Dead bodies, for example, you name it, it was used to hide the drug and import the drug and try to evade law enforcement. But the underlying premise of the war on drugs was that we were separate and apart and inferiorized and basically considered an inferior species to human beings. And so we got the brunt of every part of the failed policies that led to the war on drugs. The single most horrible thing that happened as a result of the drug war was mass incarceration. It really destroyed what remained of the Black family in poor Black neighborhoods. The destruction is so pervasive, it's unbelievable. Most of our up and coming young men got caught up in it because it was the easiest way to become an entrepreneur, and because some of these guys just didn't care about what they were doing to the Black community. I mean, face it, there's a lot of crass, immoral folk out there who profited from selling an illegal substance, kind of like the tobacco companies, you know what I mean? And so there was that too. And I got to know all of these folks. I got to know numerous drug addicts. I had to get them into treatment. I had to understand what the consequences of the addiction were. I had to help get them jobs. And the drug war was so successful in its oppression of Black people that, you know, you end up getting a felony conviction or a misdemeanor conviction for use or sale of illegal drugs. You're unemployable. I don't care how many interviews you have. Nobody's going to hire anybody with that kind of criminal record. And so, so the consequences were A, unemployability, B, lengthy prison sentences, C, acclimation and adjustment to living in a cage with a bunch of immoral people.
You might want to get up there, and we might want to sit here. Are we just doing introductory remarks now?
Oh, okay.
And that's what's part of our legalization bill.
Hey, so that's my story, and I'm sticking to it. Thank you for thank you for putting the hook on it.
Dr. Rouhani.
Hi, tough act to follow. Hi. Should I take this one? Thank you. Okay. Hi, my name is Saba, and I think my kind of path to studying drug policy began when I was at university. I went to university in Edinburgh in Scotland. There was a big kind of club culture and also club drug culture in the UK, and I was noticing things around me that I hadn't seen before, like tools to promote safety in consuming drugs, drug checking and other things, you know, safety tents, et cetera. And these were just things that I hadn't really seen here. And I certainly hadn't seen offered to certain people who use certain kinds of drugs. And so it got me, you know, thinking, and it got me interested in harm reduction. Fast forward, many years later, I moved to Baltimore. I was studying epidemiology, and I started marching, you know, extracurricularly. I started marching after the death of Freddie Gray, and thinking a little bit more critically about like what was going on systemically with racial disparities. And the pieces fit together that, you know, the way that drug policy in this country has been like used as a vehicle to enact state violence just became really interesting to me. And so that's what kind of motivated me to study this world.
Well, I really went a long time, didn't it?
You want to say that? Oh, okay. Hi, everybody. My name's Jacob James Rich, and my introduction to drug policy was right after I graduated. I wrote my thesis on the relationship between seclusion and suicide. And I happened to run into a professor named Jeffrey Myron, who is the director of graduate and undergraduate studies at Harvard. And he gave me a first task, which was really interesting. He said, how about you pull the opioid prescribing data from the DEA and compare those to the opioid death rates from the CDC? And I'm like, okay, I'll do that. And I found something very interesting. The opioid prescribing rate had dropped since 2010, but the opioid death rate had gone up since then. And then I broke it up by state, and the relationship was like this at the state level. And up to that point, I had been quite anti-drug, but I realized that the volume of drugs being put into the system had not only not a positive relationship, it actually had a negative relationship. Less prescribing of opioids, more deaths from opioids. And once I saw that, I started going around DC and saying, hey guys, hey policymakers, look at this. This is happening. And I was kind of crazy in 2016. I was a little less crazy in 2017. And every year after, people started to catch on. And now the Journal of the American Medical Association is publishing all about the relationship. So I've just been trying to be on the forefront of those types of relationships. One of the more important papers that I published with Dr. Myron was showing that when the EVALI lung diseases were happening from vaping, that the only states that had zero EVALI lung injury reports were the states that had coincidentally legalized marijuana. And it was no coincidence why, because they were getting their marijuana from regulated sources instead of the dangerous black market. So that was my introduction, and I'm very happy to be here and to elaborate on the research I've been doing.
Thank you. My name is Michael Galipeau, also known as Mikey G. That's what folks in the street would call me, because anonymity was a really important quality of the community that I grew up in. A small town in eastern Connecticut called Willimantic. In the 90s, at the time I grew up, Dan Rather did a series of really damaging docu-series on 60 Minutes calling our town Heroin Town. And I lived right in the heart of the trafficking center of my hometown. And the response that happened at that time was very much a paramilitary response. And my family was no exception. I was separated from my parents at 12 years of age for smoking a joint outside of a treatment center to try to impress a girl. And I spent the entirety of my teenage years institutionalized in a facility with hundreds of other young men, where dozens and dozens of the young men who were held there against their will were routinely and serially sexually assaulted by the religious leaders who ran this facility, where children were ordered by a judge, by the court, to be in for the best case scenario. And that was our system's response to help these families and these children. The drug war upended my life in ways that I cannot describe. It set the stage for everything else that I've done in my life since. And I have fought for drug legalization, for cannabis legalization, and I've been a cannabis patient since 2006. In fact, I was in San Diego, California during the federal raids. One of the dispensaries where I spent my time, OB dispensary, was raided by the federal government, and the people who worked there in a legal industry were held against their will by the federal government. I have been held against my will by the federal government and charged, and not only charged, but convicted of multiple drug trafficking and sales crimes. And the drug legalization movement is really important to me because the community that I grew up in lacked opportunities. There was a community that was predominantly Hispanic. A lot of folks came there in the 1960s and 70s under a work program from Puerto Rico to work in the mills. And when those facilities packed up and left, they left behind economic decay that was filled by the black market. See, drug sales in my community put food on tables. It helped me to pay child support. I was faced at different times with the impossible decision between breaking the law and paying my child support, or not paying my child support and going to jail for that instead. And so I had to face a reality that no matter what I chose to do, I was going to go to jail. And I wanted to support my son, which I felt was the morally right thing to do. And I was tired of people in my community being hurt by other people in the drug using community. So I wanted my friends to be safe. I wanted my friends to be able to get drugs that they could rely on, that they would know what was in them. And so I would test those drugs. And I went on from there to help develop not only legislation that passed in Rhode Island in 2018 to launch our first health department-led drug checking program, but then brought that program to New York State. And it was the data from our program that allowed for SAMHSA to approve federal funding to all federal grantees to purchase drug checking and testing supplies to test for fentanyl in the drug supply. And I have been a tireless advocate to ensure that my friends and my family, whom I've had to bury far too many, can be safe, that they're given the basic consumer rights and protections and human rights that everyone else in this world deserves. Thank you.
All right.
Those people that's hard to come after. But I'm going to come after and bring my authentic self. It's such a hard question to answer. I kind of had a different introduction in my mind, but I'm gonna go with what I just thought of in listening to what you all were saying and how I got to be where I am, sitting here in a room I haven't sat in a very long time. First of all, thanks for including the voices of researchers as a part of this conversation, because we have a different experience often, or sometimes similar, but we sit in a different place that brings us to this table. And I'm always really appreciative to be a part of the conversation. I think when I think about what brought me to this world, I just like radical love was always a part of what I felt. No matter where I was in my life, I was always interested in people that people didn't consider worthy of love, or people that were on the margins. That was just something that always made me feel whole, to kind of understand, I think, who we are as a population and as a country, how we treat people at the margins, really a sense of who we are. And the US just always does a terrible job at that. I lived in San Francisco and I was really involved in the AIDS kind of political movement in the early 90s, which was all about these amazing gay men, but it was all about men. And there wasn't a lot about women and HIV. So fast forward to my wanting to do HIV work in grad school and women, it took me to, it was all about drugs, and it was all about women being incarcerated because of habits that they used to support their families, habits that started in response to having violent relationships, habits that started in response to employment that they had in the drug market, that because they couldn't get other jobs. So really my interest in kind of single-minded focus on HIV and why I started doing public health work really brought me to harm reduction, which when I finally learned about harm reduction, kind of, you know, if something's blurry and all of a sudden everything comes into focus. That's how I felt when I went to the first syringe service program in the Tenderloin in like 1994 in San Francisco. I felt like a lot of stuff made sense to me. It was in San Francisco, but it felt so far from the AIDS work that I had been doing in previous years. And so fast forward, I liked numbers, I liked data, thought that I was decent. I liked stories, I like ethnography, thought I was kind of good at the skills that one needs to do this research work. And my work helps provide evidence for both supporting programs and drug policies that I think are humane and make us a little bit better of a place. And I'll talk potentially today a little bit about some of the work that we did with drug checking, that just sometimes a lot of what things Saba and I do, it's really kind of no shit research, like, you had to spend how much money to prove that point? But sometimes it's helpful to have papers written about that point that helps drug paraphernalia, you know, helps drug checking get decriminalized out of drug paraphernalia laws, or humane policies for syringe service programs, et cetera. So.
Hello, how you all doing? You all look like you're in church. I'm just gonna say my introductory remarks here. It'll take about 5 minutes. And I once learned that if somebody else can say it, let them say it. And we have a panel here, like Billy and I are always doing this kind of thing, and you guys will probably hear from us a lot. And so I want to like make sure that other people's voices are amplified here. But so I'm just going to like take 5 minutes with introductory remarks as I was instructed. We're talking about legalization, drug regulation. That's what this is about. It's important for you all to understand when I speak about this, I'm speaking from a position of more than 30 years of drug research, research in which we bring people into the lab and we give them these drugs that we're talking about: heroin, methamphetamine, crack cocaine, marijuana, so forth. And so that's primarily from the position from which I speak, but I also speak from a drug user. I'm a drug user. And so I speak from also that perspective as well. Now, when we think about one of the reasons I said I like you to understand that this is from a sort of expertise perspective is because oftentimes we have bad assumptions when we're talking about these drugs. And the bad assumption is that these drugs are, the effects of these drugs are unpredictable. That's a lie. Drug effects are really predictable. One of the things that I like to say is that I'd much rather have my kids, I have boys, I'd much rather have my sons interact with drugs than interact with the police, because the police interactions with Black boys are so unpredictable, my kids might end up dead. But with drugs effects are predictable. I can actually help my kids understand that a lot better than I can helping them to understand police. So when I think about drug regulation, oftentimes, particularly people on the left, progressives, so-called progressives, I mean, that's being disparaging. That's me being disparaging. I mean, I'm even more disparaging for people on the right. So, but when I think about drug regulation, progressives oftentimes say, yeah, I'm down with decriminalization, not really even knowing what they're talking about. So when I say decriminalization, what this means is that people are supposedly, you're able to use drugs without fearing criminal prosecution, but you can't. Drug sales remain illegal. But when I speak of drug legal regulation, I mean just what we do with alcohol and tobacco. We have some controls, age requirements, and so forth. And so I'm here arguing that the main reason I came is because I want you to know that I'm for drug legal regulation. I am for that in large part because decriminalization does nothing to deal with the issue of quality control. I mean, we're concerned in this country about drug-related overdose deaths, so we say. If we are, this is a very easy fix. Deal with this issue of quality control. We saw this with alcohol prohibition. During alcohol prohibition between 1920 and 1933, tens of thousands of Americans were killed or maimed because of tainted alcohol. When we passed alcohol, when we reversed alcohol prohibition, by the way, it's the only amendment that was repealed when we did that, those deaths went away. This is really simple. Another thing that drug decriminalization does not deal with is this issue of arrest. Police selectively arresting undesired people who look like me, for example, Black people. I mean, people say, well, decriminalization should deal with that. A city like Baltimore in 2015, after 14, you guys decriminalized cannabis. Between 2015 and 2017, the city of Baltimore arrested 1,956, I believe, people for, or actually it was just over 1,500 people for possessing cannabis. 96% of those people were Black. New York City does a similar sort of thing. New York, cannabis has been decriminalized since 1977, but you wouldn't know it by the arrest of Black and brown people in the city. So decriminalization still allows cops to have this discretion. And so that, therefore, I'm for drug legal regulation for those reasons primarily. So when you hear the progressives talking about decriminalization, it does nothing to deal with the things that we say are the problems. Those are my introductory remarks, and I'm gonna sit and allow these smart people to do their thing. But I'm in the audience, and Billy and I, we will have our arguments too in the audience, but I wanna make sure that we don't get in the way of everyone else.
By the way, did you hear him almost say brilliant and then draw that back and say smart?
Perfect. Thank you guys for all of your introductions. We are going to open up the panel discussion with the question, what research is there to support drug legalization? What are some key ideas from research to indicate that what we have been taught about drug prohibition is wrong? And we can open up for any panelists who would like to start.
That sounds like a question for the researchers, right?
Who wants to say it first?
What kind of research?
See, now you made everybody afraid to talk about decrypt. Okay. Do you want to talk about the research around legalization?
Yes.
Yeah. We all talk on,
What do you mean research around?
no, the question, I just thought you would be a good person to.
The evidence around legalization.
The evidence?
Yeah, I mean, what evidence out there, because some people are skeptical.
Okay, you all live in the United States, right? You don't know anything about the Declaration of Independence? It says that you have, as birthrights, life, liberty, and the pursuit of happiness, meaning that you can live your life like you choose as adults. If that's the case, why can't you go out and purchase a psychoactive substance without worrying about being arrested or the quality of the psychoactive substance? I mean, it's in the Declaration of Independence. It's the founding of this country. People like Thomas Jefferson, Ben Franklin, all of those guys did opioids. They helped them to enjoy their life, particularly in old age. This is not new. So the question being, so when we say what research, it's the founding document of the country that gives you that right. But the problem is, they make us read it when we're 12. You don't have any liberty. It's not relevant for you. And nobody else bothers to read it after that. And then the next sentence, after giving you those birthrights, it says that governments that does not secure these rights should be disbanded. And this is not a libertarian or a Republican issue. This is an American issue.
Thank you. I have a lot of good feedback, Hart.
So wait, I am gonna, I appreciate your bringing that up. That's like good. See, I bet you talk about that with your boys. It's a good thing to remember to talk about, the Declaration of Independence. There actually is evidence out of Portugal when drugs were legalized and when they were decriminalized. Well, they were decriminalized, which there are critiques about, but just to say, overdose rates went down. Obviously, it's a whole different context than the carceral and racist war on drugs in the US. But drug decriminalization in Portugal at least showed that it got public safety out of the way of what really can be a public health issue, which is around drug use, and B, uplifted services that needed to be there, whether they be harm reduction in the form of certain service programs, drug checking, which was a part of just basic offerings in a like Saba talked about, it wasn't anything that had to be tested or studied. It was a part of public health systems, or whether it be drug treatment being expanded, that's where the focus went. So even though that is decriminalization, not legalization, it points to the fact that there is a lot of evidence when the laws change and substances are no longer criminalized, which doesn't speak to people that sell, that good things can happen and systems that need to be developed and get resources can be resourced.
And the research to support legalization of all drugs, you have marijuana legalization, you have alcohol, that's legal. You have in Switzerland, you have the HAS program, heroin treatment.
In Canada.
So I mean, and that's been in existence for decades now. So there's lots of research out there we're living in.
Yeah, I mean, if you look back at the history of harm reduction, the early certain service programs that were run, in Netherlands and by the Liverpool group was also operated alongside of physicians who were able to prescribe heroin and cocaine to people who are drug dependent. And just look at the epidemiological outcomes of the data that those programs were serving in terms of preventing the spread of infectious disease at a time when HIV was killing people throughout the world. I mean, there's ample evidence. Vancouver also had a heroin-assisted treatment program that they piloted and had incredible success with people who had not been able to be successful with other forms of medication-assisted treatment. So, and the fact that we even call it medication-assisted treatment is astounding because it's medicine. We're practicing medicine, and even calling drugs drugs provides the wrong context and the wrong connotation because they're medicine. These are substances that have been used by people worldwide throughout the entirety of recorded human history to benefit their health, to strengthen community, to provide us with culture and diversity and art and philosophy, thought. These substances, these sacred parts of our environment were gifts to our species that we co-evolved with that are essential to our evolution. They're essential to our well-being. And to criminalize something, just look throughout the ample evidence throughout human history. How much of our music and our art is influenced by substance use?
Well, let me, while you're speaking, Mikey, I want to ask this question because I know that this is a question that people may have, listening virtually. And that is, and this is the one that we were talking about last night. We're talking about legalization of all drugs. Some people might have some, hesitation there, like, okay, how do you ensure that people won't become addicted? If you legalize all drugs. And so you talked about the continuum of substance use. Can you expand on that?
Yeah, so there's a substance use continuum, and it's driven by predominantly like social indicators, right? The substance use for people who experience, right, there's a range of total abstinence or partial abstinence to chaotic use and everything in between, right? And so people engage with substance use depending on where they are internally. It's called the drug set and setting, Dr. Norman Zimberg, right? And he talks about how your mindset and your environment influence your relationship to substances. And so those things are important. The context in which use occurs in, right? In my home environment, there was a lot of poverty. There were a lot of issues that were systemic. They were endemic. And so people's relationship to substances was driven by an unhealthy environment. So the types of relationships they form, the types of attachments, we have created a segregated understanding of what addiction is, which is people doing what human beings do within our nature, which is engaging in repetitive pattern-seeking behaviors for self-soothing to be able to cope with internal and external stimuli. We don't only do this with mind-altering substances, we do this with our food, we do this with sex, we do this with social relationships, we do this in every arena of society. And when there's toxic stress, people develop stronger attachments to these self-soothing mechanisms, right? And so it's a response to toxic stress in an unhealthy environment. And if we look at the life continuum, right? As problematic substance use on the life continuum goes up, quality of life is at an all-time low across the lifespan.
All right, so
Veronica.
yeah.
Go ahead.
Why do we always talk about addiction when we talk about drugs? It's like talking about car accidents when you're talking about driving a car.
Right. Well,
It's a trap. That's a trap.
Addiction
And I
has
think-
no metrics.
And I
But
think it's important.
we can explain it because we've been in an anti-drug society since prohibition of alcohol, and probably earlier than that. We became a nation of drunks because alcohol was a vital part of the westward movement, and everybody drank because it was such a hard road to hoe. And so we have constantly had to battle addiction. And we passed a constitutional amendment to stop drug addiction.
Well, we did that, not for drug addiction. That's not why we did that. That's not true. But we did that for a variety of reasons, but not because of the drug addiction.
Well, if you listen to the people who fought the hardest for the amendment, that's what they were fighting for.
No,
But now hold on.
The hardest were racist. They for a number of reasons, because they didn't like the Germans. There was a variety of reasons that went into that that amendment. So addiction is this issue that shuts down this conversation. When we think about alcohol use today, there are people who get in trouble with alcohol. About 10 to 15% of the people who drink. But we're not talking about, we're worried about legalizing alcohol because of addiction. That would be like saying we're worried about having people drive cars because of those people who crashed their cars. I drove here, by the way, and there was an accident today on the highway. But we're not talking about banning cars. And driving a car is obviously potentially dangerous and that sort of thing. But most people who drive a car don't have a problem. So why are we always talking about addiction? It's a trap.
I was explaining why. I didn't say I agree. Now, what's the reason that we ought to ban the illegality part of using drugs? Totally ban it. Let everybody use the drugs that they want to use.
Again, that's another.
No. Everybody who wants to use it. So don't parse me too tough.
But I don't want you to put these arguments in black and white.
Yeah, but give me a chance to make the argument before.
In a lot of ways, the way that we've responded, right, as a society to the idea of addiction has been to create a system that looks exactly like the rat experiments, to create the social conditions that would almost certainly produce this pattern of addictive behavior in a mammalian species, right? By creating cages where we locked people away and we took away their human rights and then somehow expected people to be healthy.
Only some people get
specific people.
I think we're getting off the point.
Yeah, let Billy finish it.
I think we're getting off the point. There are essentially two choices that we have. We can continue with the overregulation of drugs, or we can be intelligent about a new regulated regime aimed at reducing overall harm. And so what reductions of overall harm would legalizing drugs bring about? The end of incarceration for drug use and the end of the black market for adulterated drugs, dangerous drugs, the end of criminal courts being the major engine of what happens to the lives of people. There's so many ways to do it. The end of gang violence, the end of drug-related violence. The choice is, if we keep doing what we're doing now, we're going to have all of that. But if we get smarter about it, we can knock out most, if not all, of these other problems that are associated with what we do about drugs that are potentially addictive. Now, I agree that if you focus on addiction, that's a trap. And so we've got to focus on harm reduction. We got to focus on what the difference will be actually in real terms, in practical terms, with the consequences of legalizing all drugs.
And drug legalization is harm reduction, we didn't focus on that.
Correct.
Can I just say one thing though?
Yeah.
You know, when everyone in this room hopefully agrees with what you just said. It makes no sense unless you think about all the people that profit off this.
It's
I mean,
a jobs program.
It's a jobs program for prisons. It's a jobs program for police. It's a job. It's a jobs program for people that need to study it and Columbia at Johns Hopkins. Yeah, that's right.
Well,
But my point also is, I think it's just important when we think about, you know, you can talk about all the common, it just makes sense why we would legalize drugs. It's human rights. There's so many reasons why it makes sense to the society as a whole, except when you think about who benefits from keeping people down, who benefits from racist policies, who makes money. And I don't excuse, you know, where we're sitting or where I work in that equation, which is.
Where I work.
Yeah, I know. No, I know.
We're not
But
going to
anyway.
eliminate capitalism.
No, I know, but I
There are
think
going to
it's
be people who profit off of harm reduction. I'm not concerned about
Oh,
that
no,
as
no, I'm
long
not
as we
saying-
actually get the harm reduction.
that's not what I'm saying at all. I think when you have a conversation about legalization, it's always important to think about who makes money and why illegalization is so much a part of our society and why people only focus on problematic drug use, including researchers who only study and get funded from the NIH to study problematic drug use, not recreational drug
So
use.
I would like to ask a question for Dr. Rouhani, because I know she's been trying to say something. And she hasn't been able to get a word in.
No, thank you. No, it's all good. I think what I was going to say was said. I think when you ask, like, what do we do about addiction if we legalize as everyone here has said, that suggests that we're doing something about addiction under the status quo, which we're not at all. Like the current system, like all of the evidence suggests that how we are handling things is amplifying the harms. If you go into the carceral system, all of these things that actually increase your risk of moving along that continuum to becoming part of that small percent who are in fact, dealing with addiction, all of those risk factors for moving along that continuum are amplified if you're, as people have said, like you don't have access to employment, housing. I mean, other things. And then also folks who are leaving the carceral system, their tolerance has been interrupted. Their overdose rates are way higher. I think that question distracts from the fact that we're doing nothing about that under the status quo.
I have a question for you. And that is, can you share with us what you found in your evaluation of Baltimore State Attorney Mary Mosby's decrim policies?
I would love to. So in, as we've discussed, decriminalization is really distinct from legalization. And I agree with Dr. Hart's, I agree with the key sort of inherent flaws of the decrim model being that it doesn't address safe supply at all, right? It relies on police discretion. I think legalization can also have police discretion issues, but it's not as vulnerable to those as the decrim model. And I think, but nonetheless, here we are. Baltimore City has enacted what is sort of like a de facto decriminalization model. So it was enacted through prosecutorial discretion rather than any change to the law. And what that means is that in March 2020, State's Attorney Marilyn Mosby said that she would stop criminally prosecuting possession of drugs or drug paraphernalia among a suite of like low-level nonviolent offenses that she said she would stop prosecuting. This happened in the wake of COVID. This was, March 2020. So there was kind of political appetite, I think, for decarceration in the name of infection control. But she, a year later, she had been thinking and talking about the way that the drug war has impacted communities of color specifically. And so I think she declared it at that time. And then a year later, she formalized the policy and more explicitly said, this is going to be our strategy to address racial disparities in the criminal legal system, and to sort of take substance use issues out of the purview of the criminal courts. This was the stated goal. And I think one other important thing to note before I get into our results is that in terms of policies of its kind, the Baltimore policy has been quite comprehensive in that it hasn't been limited to a particular substance. So this applies to every substance. They also haven't set clear threshold. They haven't set like a threshold beyond which, a quantity beyond which possession becomes a criminal offense. And also they've been trying to apply decriminalization in some way retroactively by dropping pending charges and quashing outstanding warrants that were related to the possession of drugs or paraphernalia. So that's the background. And this gave us, an opportunity as researchers to look at what happened after this policy went into place. And we used court and police reported arrest data. And we first wanted to answer the question, like, did this directive actually result in reduced arrests? As Dr. Hart said, we've seen in other experiments in the past, arrests not going down and certainly not going down in certain communities, right? So we wanted to see, did arrests go down? And we found that arrests for possession went down by 82% after the policy changed. So that's great. We wanted to see, very importantly, well, first, before I get into that, what we did is we compared, like based on pre-policy trends, we calculated how many arrests we would have predicted to occur in 14 months after the policy change. And then we just subtracted what we observed from that. And so using that, we estimated about 443 arrests were averted for the possession of drugs and paraphernalia in 14 months after State's Attorney Mosby declared that she would stop prosecuting. 78% of those were among Black residents. So 78% of averted arrests were in the Black community here. That's great news. That's evidence of like, substantial reduction in exposure to arrests, right, among people who use drugs here. However, when we looked at, what we basically saw is that, I'm just looking down because I've got my numbers here, is that we went down to about 43 mean arrests monthly happening since decriminalization has happened. 39 of those 43 mean monthly arrests are still happening in the Black community. So that's a 13-to-1 ratio in the arrests that are still happening. Nonetheless, they went down hugely. The like net number is really significant, but this hasn't by any means been like a fix to racialized policing. And I would argue that I don't know that legalization is in itself sufficient to also fix the racialized policing issue. But anyway, that was our first finding. The second question that we wanted to answer was, given that this policy was really controversial, there's a lot of public concern about whether it would lead to violent crime. We just looked at, among those individuals that I said who had their warrants quashed and their pending charges dropped, did they actually go on to commit, any more serious crimes in the 14 months after the policy change? And we found that among 741 of them, we had de-identified records for everyone, only 6 reappeared in the system for a more serious charge. So that's less than 1% recidivism. And I think that was like very critically important because, a lot of decriminalization and legalization policies are undermined by public opposition that's rooted in a fear or a notion that somehow if you don't arrest people for their drug use, you're missing like this opportunity to catch them before they go on and pose a threat to public safety. And so the Baltimore experience has shown us that like empirically, we don't have any evidence that they will go on to do that. And I think in this room, that might not be a surprise, but that's really important to have, I think, for advocacy when it comes to building these policies. And I think that I'll wrap up now, but I think, the next and more salient question really is like, has this translated to health, to better health and social outcomes? That's what we have to study next. But I think that if it does, we'll rely on whether things like access to employment, educational opportunities, housing, health services has gone up in the wake of reducing exposure to policing and arrests. And that is tricky because of things like safe supply not changing, police discretion, as well as, unfortunately, the inherent fragility of the prosecutorial discretion model. So as we're working really hard to evaluate what happens next, we have an election looming, and we have candidates for state's attorney, both of whom are pledging to start criminally prosecuting drug possession again.
And some of them are popular.
Very popular, yeah.
And some of the community that we really care about.
We're gonna segue into the next question.
Just
We're
a
wrapping
minute.
up.
Just
We
one
want
minute.
to let the rest of the panelists get a chance to speak, and we've been focusing a lot on the negatives tonight, so we want to do a full 190 and end the panel by talking about what does smart drug legalization mean and look like to you all, and how do we do it, and what will it take to make this US policy?
I was going there, and here's what I was going to say. The police are really angry about curtailing marijuana arrests because they know that marijuana is a gateway drug. It's a gateway into the wholesale violation of your privacy because they have been operating under a regime that if they smell it, that's an invitation to search everything in your car. And our Supreme Court has gone along with that. And so this is their #1 law enforcement tool. That's why it persists in the Black community. And we've got to stop that from happening by looking closer at the collateral consequences of the unintended collateral consequences of the reforms that we all believe in. We've got to stop them from being able to use marijuana under any pretext as the gateway drug into arresting them, searching their houses, et cetera, et cetera. You've never seen a search more invasive than looking for seeds to prosecute. I mean, you can look everywhere, there's a seed. And so this is nonsense. Now, what are the other positive things that we can do? We can pay more attention when we have this harm reduction model to the desires and emotions of the community where this is taking place. And my view is that these programs, although they're exceptionally well intended, are not going to really work until we get a handle on policing and we start controlling the police department. So there's one thing that I want to point out to everybody that you got to pay attention to this election cycle. Baltimore has a referendum, not just on the legalization of marijuana, but assuming complete control over the police department in Baltimore City for the first time. We have never had control over the police department in Baltimore City since 1852. This was called Mob Town. It was so corrupt that they took away Baltimore's elected officials' ability to run the police, and they took it into the state control. Now it's time for us to take responsibility for how we are policed and to do something about it. So vote for the control in this election of Baltimore City over its police department.
Is anybody else on the panel that want to address that question? Jacob?
Yeah, sure, I can do that. And the reason why I'm going to do that is because my organization and myself have had much to do with all of the legalization bills that have passed throughout the country. I've written some of them, and it takes a lot of strategy. If you look at what Ethan Nadelman has said, and he's one of the founders of the Drug Policy Alliance, right? He said that, quote, medical marijuana legalization really was never a medical type of thing. Do people use marijuana for medical purposes? Of course. But the whole idea was basically to very strategically allow people to use it for whatever purpose they wanted and to provide broad access. And by strategically labeling it as a medical bill, they thought it would have a higher probability of passing. So there's two types of approaches you take to pushing legalization. You can either go at the state level and basically convince state lawmakers to completely defy federal laws, or you can just go to the top and work there. That hasn't worked at all. So that's why everything that you've seen go forward is at the state level. But at the moment, Veronica and I are actually working on publishing a book, a manual for how state legislators can go forward. And just as marijuana was presented as a medical type of substance, every other substance could also be presented as that type at the state level to push those policies forward. And at the federal level, I sort of want to inform you guys that we actually don't need Congress to legalize drugs. The only good thing about the Controlled Substances Act that was passed by Richard Nixon is that the entire scheduling regime is actually under control by the executive branch. So if Joe Biden right now told the Secretary of Health and Human Services, would you please reschedule marijuana, it would be rescheduled. There's a little bit of a bureaucratic process that goes down, but for all intents and purposes, he doesn't even need Congress to completely deschedule and legalize marijuana. So if we actually had a president who wanted to do this, we wouldn't need Congress. It would be an automatic fix. And the beautiful thing about this is that we don't need Congress even to legalize heroin. Every single substance is under the Controlled Substances Act and is inherently controlled by the executive branch. So when we're trying to push policies forward, think of those types of strategies and those type of opportunities, which have not been exercised yet.
There's one thing I wanted to add, and it's important to say here that, I've worked in drug user organizing for many years, and I currently serve as the National Cannabis Liaison to the Urban Survivors Union, which is the National Drug Users Union. And what's important to say from a community perspective is that the illicit economy has played a vital role in survival economies where capitalism and traditional economy have failed. And to take those resources away from those communities and not find ways to replace them, to not find ways to meaningfully include people who've been directly impacted by the war on drugs is an absolute failure of legalization. The one and only time that I ever turned out 3 full floors of people to testify against a legalization bill was in the state of Rhode Island when Gina Raimondo tried to propose cannabis legalization through the budget to create a state-run monopoly that would ban patient socialization, that would deny people who use cannabis the guaranteed constitutional rights
They did that in Ohio too.
in this country. And we fought against legalization as drug users. And we literally parked a bus outside the State House where we had places that people could go smoke dabs and do what they had to do so they could go out and go back in the State House. And we laid siege to the State House until 7 a.m. We refused to let up. And that's what I'm talking about. Legalization is not real reform without restorative justice and community reinvestment.
Okay, bringing it home. Okay, we're gonna do Q&A right now for the audience. Okay, because you know, we don't want to exhaust you with all our answers. We got a lot to say about this topic. And there's not enough time in the day, but we're gonna open it up to the audience for your questions. Because that's what you guys want to do now, right? You ready? Anybody? Okay. Is there a microphone for him or?
Yep. The ceiling has mics.
Okay.
I'm also really loud,
Okay.
so that problem.
We might want it for Zoom though.
Oh, yeah, so I'll speak extra loud for the people on Zoom. Or I can. So my name is Thomas Higdon. I'm a person in recovery. A person in recovery. And just a side comment before my question. My experience was that the war on drugs created a barrier. It exacerbated my addiction and it created a barrier to recovery. So whenever somebody talks about, criminalization as protecting people from addiction, I just want to call bullshit on that from my own personal experience. But so I've gotten involved. I fancy myself as a citizen advocate. I do have a full-time job, but it's not in the drug policy space. So I went down to Annapolis and testified on some bills this year, and I see I'm practical, and so I don't see Maryland turning around tomorrow and legalizing all drugs. So I look at other states like Oregon as a stepping stone in that movement. So I hate to say it, especially after Carl Hart indicted the term, but decriminalization as being a stepping stone towards full legalization. But I would like to hear about the experiences that people have seen in other states in sort of taking that incremental approach, for example, in Oregon or at the state and local level of introducing, basically building a coalition. From everything that I've read about what happened in Oregon, it wasn't just one group, it was everybody from across the community.
Listen right here, the National Coalition for Drug Legalization. We need to get together after this.
Yes, well, that's one of the reasons why, because
Can you ask your question?
Yeah,
so that we
what's the
can-
question?
yeah. So could you talk a little bit about the Oregon experience?
I wish I had more to say about it because that's a part of what I'm actually researching at the moment. I could discuss what I expect to see. Oh, Howard, would you like to say something?
Yeah.
We have another celebrity in the room, by the way, who's very happy to join us.
Member of LEAP, Law
Yep.
Enforcement Against Prohibition.
Yeah, you can take the microphone. Go ahead and answer to Howard.
Yeah, Oregon was one of the 17 states with defelonized simple drug possession. As this country has moved from lock them all up to more compassion. Oregon voted initiative referendum 5842 to make simple possession of all hard drugs a civil infraction, much like a parking ticket. When I say simple possession, I'm talking 2 grams. That's like 2 packets of Splenda. Okay, it's really personal amounts. When you are stopped, they take the drugs away from you. You never get them back. And then you simply see a health assessment committee the next Friday. They make a determination whether you need treatment or simply you're a casual user and don't need treatment. And that's all you have to do to fulfill your legal requirements for the state of Oregon. Oregon did not do this as a pig in a poke. They didn't know what they were doing. They took the 20 years of Portuguese experience and said, this is where, and basically copy and paste. They're doing it almost exactly the way Portugal's been doing it for 20 years, very successful. It's withstood left and right-wing governments over 20 years, and they keep the program because it is successful for some of the reasons these folks have said. And the great news is, from my perspective as a police professional, drug action or action by the police is down 80% in the first year. 80%, and a subsequent 80% drop in car searches back to your point, because these racist POS officers that I used to work with who just get off in the sick way of harassing people they don't like, they now are frustrated because all they can do now is give this guy a piece of paper like a parking ticket. And this 80% in the first year, which you also cooperated with Baltimore. So, but I think this is going to happen here. You can't get rid of racist officers without cause, but those who do this because they like it, I think are going to leave the profession when they can't F with people they simply don't like. So Oregon is the model. Anything we can do to bring that to other states. 9 states, by the way, this year have put that bill in, including Maryland. It didn't pass. We need more public support to say, you know what? If you have a drug problem one day, see a doctor at a clinic. Yeah.
But I love Howard. Howard is an expert in this subject. He's the founder of Citizens Opposing Prohibition. He's one of the co-founders of LEAP. So he knows, he's been doing this for 20 years. So I try to give Howard his props. And thank you for being here today. All right.
Hello, my name is Rachel Wisner. I'm the development director at Students for Sensible Drug Policy based out of our DC office. And I have a question for y'all, but you don't need to make it a long answer because there are other really wonderful questions I'm sure need to be answered. So how do you feel that medicalization of drugs has impacted the movement to legalize, right? I hear there's a lot of people who are very much against medicalization because they feel like it's adding more stigma to other drugs like heroin, crack, and cocaine and methamphetamine. And some people are like, no, this is how we normalize it. So I'm curious to hear all your answers. Thanks.
It's certainly a double-edged sword because I said it's a double-edged sword. Yeah. Because like I said earlier, medicalization is how we brought it. That's basically how we started the legalization process. But if it's always going to be tainted as only people who are near death from cancer should have access to a drug, well, that's tainting it as we only let people who are near death because it's an inherently dangerous substance. And it's definitely not the destination. So how to use medicalization language in the path, it's not clear. Sometimes it's helpful and sometimes it's not. But the overall goal is for medicalization to be completely removed from the legalization. Yeah. I mean, unless it's actually for a bona fide medical purpose, because drugs have plenty of medical purposes, but not all the purposes are medical, and we don't want to create any sort of undeserved stigma for the non-medical uses that still bring joy to many people.
I have a different perspective.
Okay.
I think that medicalization has sped the movement towards full deregulation of marijuana. I think that we have added so many people who either are buying medicalized cannabis, which is the same as the cannabis that you can get after it's fully legal, and they're secondary users who use that cannabis that they get legally from the dispensaries. And so you've exponentially increased the number of cannabis users in Maryland. And the result is the cannabis is more popular than ever. And so we are going to actually pass the constitutional amendment to quasi legalize or regulate it. Now that's progress, I think. And I think it's irreversible progress. And I think any politician that tries to go backwards is going to face a backlash from the increasing number of cannabis users in America. So that's my point about it.
I think I can project, thank you. So my name is Paula. I'm a student here at the School of Public Health. And I want to ask you what you all think about framing drug legalization and regulation as reparations for historic mass atrocities, such as colonization, enslavement, US military intervention, mass incarceration, including detention and deportation of immigrants, as a public health strategy. And I want to ask you all what you think, what kind of possibilities open up if we prioritize unearthing historic memory as a public health political strategy.
I'd much rather hear what you have to say.
Yeah. Well, it's not just the problem of the American drug war, right? Like we brought this drug war and our obsession with eradicating substance use to the world, and it's had catastrophic consequences. You know, one of the projects that I've had the privilege to be included on has been looking at the devastating impact of the drug war in Colombia and working with folks, you know, in indigenous communities who are literally fighting with their lives and dying to protect their rights to their sacred plants, like the use of coca, which to this day, by the way, still has not had the most basic of research done to explore its therapeutic potentials, even though there's ample evidence throughout the history of traditional medicine using it for a number of different medicinal purposes. But what we don't understand about the drug war is how devastating it has been on our ecology. You know, we removed different plants and keystone species from the environment without any consideration for the environmental impact of those actions, right? The removal of coca, the removal of cannabis, which literally propagated itself all over the world. You know, we had an ample supply of cannabis in our endocannabinoid system through our animal-based food supply chain. There were plant-eating mammals that had ample cannabis in their diets that also had endocannabinoid systems that evolved because it was a part of their diet. It was an important part of our ecology. And then the driving forces of illicit economies in Colombia right now, the Amazon rainforest, the greatest significant driver of deforestation is the expansion of cattle ranching in Colombia, because people have to find ways to wash illegitimate money and turn it into legitimate economy. And so we have to look at innovative solutions to literally stop ourselves from destroying ourselves in this planet. 25% of the world's oxygen is produced by the Amazon rainforest, and its single greatest driver of destruction is prohibition. I mean, what more do you need to say than that? We are literally destroying our planet over this.
Can I just add one quick point to that? Because you ended with an important or interesting thing is like, how can this be used in the advocacy movement? And I think, you know, we've seen, I'm sure others have found this, but in some of our polling around decrim and legalization, we've seen that some of the groups that are maybe most affected are not in support of some of these measures, and figuring out engagement strategies is a challenge. And so I really think that what you brought up is an important thing to kind of, because I think folks don't believe, you know, a lot of folks don't support it because they're just like, the cops aren't going to stop messing with us, whatever. But to really organize around some of the issues that you brought up, I think could be a meaningful engagement strategy.
Lawrence.
Good evening, everyone. Lawrence Grandpree. Thank you. Lawrence Grandpree, Director of Research, Leaders of a Beautiful Struggle. We're a grassroots think tank here in Baltimore. That question was really interesting because it's along the lines of what I wanted to present, which is I think that unfortunately, the way it's being applied, a reparations framework and a public health framework might be a bit of an oxymoron. Because what people are experiencing is public health is quickly becoming a top-down sort of elite-driven methodology. And as I've defined reparations, working at the state capitol, trying to redistribute the funds from legal cannabis, which we helped write that part of the bill, the people who were aggrieved by the harm have to be empowered to choose the solution and the mechanism of redress. And public health increasingly is telling folks, we know what's best for you. Trust us, we're the experts. This is how it's done. That's kind of what happened in Illinois with the R3 program, which they call reparations, and basically people just hooked up their friends. So my general question is, how do we account for the specific role of anti-Blackness, both in investing in grassroots bottom-up organizations and the actual enforcement of harm reduction? Because I've looked at Portugal. I think if it comes to a place like Maryland, it's going to look a lot like drug courts and be a potential another vector of criminalization and violence.
Yeah.
No, amen.
By the way, shout out to LPS, one of the most effective organizations arising out of the Black community in the history of America.
mean, I want to add that one of the major challenges, right? And it's confronting harm reduction in this public health framework because see, people with advanced education are typically not the people who've been directly impacted by the drug war. I didn't even learn about going to college until I went to prison. That was the first time anybody had ever even talked to me about getting an education because people didn't do that in my community, right? And so what happens is you wind up with institutions that believe they can do something for you or to you instead of with you. The entire movement of harm reduction has been built on a philosophy that there is nothing about us without us. And it's that kind of solidarity, whether we're talking about the plight of the African American community or we're talking about the plight of the Hispanic community, we have to be able to be willing to lend whatever power or privilege that we have, as me, as a person at the front of the room, to share the mic with somebody who isn't heard, or to share my knowledge or resources with somebody who hasn't been taught, and to make those investments in our community, because we need real investment in leadership development and capacity building, and that takes sacrifice.
Can we take a question from online?
Well, the last two questions both asked about reparations, and we didn't really discuss reparations, so I thought we should do that real quick.
It's kind of similar, actually, just I'll throw it in.
Okay, good. Throw it in there because I want to elaborate on
Yeah,
that.
so they were asking if all drugs become legalized, it would be possible to release individuals from prison for drug-related charges. So retroactively, how do we do it?
Yeah, I mean, it is possible. That's exactly what we need to do. And we need to remove all sorts of negative consequences from laws that were unjust in the first place. I think that's a pretty concise way to answer that question. And it's been done in some places. Cleveland, Ohio, I go to school at Case Western. I'm a PhD student there. They just expunged the records of like thousands and thousands of marijuana arrests and criminalization events. So we're very happy to see that it's being done, and we hope that proliferates. On the reparations and it being tied to public health in general, I think you kind of inherently have to separate them because I think they are two different things. Like public health, we want to improve the health of people. Then reparations, that's justice. And both are incredibly important. And we sort of heard about how reparations have been not going to the places that they need to go. And I think when we talk about that, we need to be very precise about who's supposed to be getting the funding. A lot of times it's very broad and says, we want to give it back to the communities who have been hurt. I don't know what that means. And that means that maybe someone's friend is just going to get a whole bunch of money to not spend it on anything useful. So my suggestion, it doesn't have to be like this, but it needs to be the specific. We know who went to prison. We know who was arrested. Why aren't we just giving them cash? Why is it not just that simple? So when we think about reparations, just make sure that's a very specific thing and it's going to the people who were actually harmed. And it's going to be in a way that's going to be equitable, because if more people are arrested of color and you're giving it to the people who are arrested, it's going to be distributed in a way that's necessary, right? So those are my only suggestions. And on the public health aspect of drug legalization, it's exactly what I described at the beginning. Legalization has never been completely illegal or completely legal. We've always been on a spectrum. Well, that's not completely true. Marijuana has been completely illegal in this country, but it's the only drug that's been completely illegal. There's different circumstances that have allowed you to legally consume opioids, right? If they're prescribed by a doctor, amphetamine, which is very similar to methamphetamine. That could be prescribed by a doctor, right? The public health aspect is trying to be morally neutral when you're discussing this. Just say, well, what policy leads to less death? The policy that leads to less death is people having access to the pure versions of their substances. And that's how you pursue these types of arguments. You don't say like, it's my right to use drugs. It is your right to use drugs. But if you're trying to convince a conservative, say, I want to reduce death. That's why I want drugs legal. When people who want to consume opioids are able to go buy pharmacy quality opioids, that's how you reduce death. And it's no coincidence that we have the lowest opioid prescribing rate in decades and the highest opioid death rate. Believe it or not, opioid addiction in this country is actually at least a 2 decades low. If you look at the Substance Abuse and Mental Health Services Administration, they actually report the addiction rate, and it's been dropping for at least 5 years. And compared to the last 20 years, it's at its lowest rate. But we have the highest death rate. It's absurd. And it's because the drug supply is so dangerous. There's really not a strong relationship between the number of drug users and the deaths. It's all about the drug supply quality. And just trying to point at those numbers, I think that type of consequential argument is the most effective one we can have.
Yeah, and the role of interdiction has had a direct relationship to disrupting reliable supply chain. So you take the best actors out of an economy and you incarcerate them for life. And then you take the least reputable actors because they're willing to snitch and turn on their friends and they're dishonest, and you keep putting them back out into the street and it proliferates. I mean, we created a system to make the most unreliable supply chain possible. And then we're asking ourselves questions why everybody's dying from it.
We're gonna take one more question and then, wrap it up.
Thank you. Okay, I have been. Okay, awesome. Hi, everyone. I'm Kat Ebert. I currently serve as the chair of the board for SSDP, Students for Sensible Drug Policy. I have a specific question for Mikey, and you kind of went into a little bit of it earlier, but anyone can elaborate as well. I noticed that there wasn't a whole lot of talk about how the drug war affects youth during this panel. So my question, Mikey, is you recently worked with SSDP on a mutual campaign to address the environmental and health consequences of aerial fumigation of indigenous coca and cannabis farmers in Colombia. Can you elaborate on how students can more effectively, or young people, can more effectively partner with those with direct experience of suffering consequences of the war on drugs?
First of all, I want to thank you for asking that question. And the way that students can partner is by working with people in your community. If there isn't a drug users union, to develop one, and you can get support from the national union, from our leadership and the folks who have done this organizing work now for decades. And if there are local drug users unions, to find and partner with those organizations, right? And to develop meaningful relationships. To address the question of children, this is really truly the greatest untold tragedy of the drug war. The parents who are arrested and separated from children, those children are ripped out of homes and placed into foster care where they're more likely to experience abuse and sexual abuse. And this story needs to be told because then those children become traumatized at an early age. And we know based on the ACE studies that were done that people have an exponential likelihood to develop a substance use disorder themselves, to develop problematic substance use in relationship to having childhood trauma. And then we put children into a system where they are then more likely to experience that type of separation. The act of separating a child from a family is in and of itself traumatic. And we have no support systems that prioritize keeping families together, that really meaningfully invest in the financial needs and in the reality needs of parents that are trying to raise children in a world where our economy has experienced some of the greatest inequality in human history. We work longer, we work harder, and we have to do more with less than any generation of people in human history. And yet we have to find ways to provide leadership and guidance to our children in a world where we have started to really struggle with having really solid role models. And it starts with having people who are willing to stand up against injustice, who are willing to be leaders in our community. And I'm not just talking about people that look like me, but I need people that don't look like me to be role models to these children as well. And we need to stand together against the injustices of our society. We have created a world where the treatment of human beings is absolutely disgusting. And we need to be honest with ourselves about that. We need to be honest in our evaluation of what we allow to happen, that people live in homelessness, that people who use drugs in this country have death rates that are worse than those of any third world country. And that's right here in the United States, supposedly the heart of success. And yet this is what we experience. We have to be honest. And we have to be willing to go out and have these difficult conversations with other people. And we have to be willing to ask them to get uncomfortable with what's happening in our society. I can't walk down the streets of New York City without seeing the incredibly fearful looks of the homeless people living on the street, the terrified looks of loneliness and isolation. And that starts with our society's acceptance of separation. We have no collective responsibility as a community towards each other. And if we looked at the plight of people who use drugs in our community as the canaries in the coal mine, we are in real trouble. And it comes down to each and every single one of us to be willing to take action and do something that makes us uncomfortable. When I started doing harm reduction work, it wasn't acceptable. It was a felony to possess and distribute Narcan. I had the police try to charge me with accessory to murder for giving a guy a Narcan kit. And this movement was built on people who were willing to act up and act out and do what was right, no matter what the law said. And it took acts of personal courage and sacrifice to make this happen. We are where we are today because we stand on the shoulders of giants, people who are willing to risk everything to try to change what we're doing. And we have an enormous battle ahead of us. The system that we have invested ourselves in with capitalism, with individualism, the crisis in our values is pervasive.
Mike, can I add something?
Yeah.
Make two recommendations. First of all, our current crime wave is caused by children who don't have parents and who are raising themselves. They are not socialized. They are not educated. They have become hostile to the ways that they've been treated by regular society. And we're doing little or nothing with those children and about those children. The two recommendations I have are as follows. We've got to take control of the terminology that is in use. Our enemies control the terminology. We use their vocabulary, their words, their concepts, and we are at an inherent disadvantage when we let them define the disputes. So we've got to take control of the means of communication. One great step forward was we don't use the word marijuana anymore. We use the word cannabis because there's not a historical attachment, negative attachment to that term, but we're talking about the same plant. The second recommendation I would make is that everybody who wants to help has to have intimate contact with the people you are trying to help. We talked about this top-down view that progressives take and liberals take because there's a lot of noblesse oblige there. There's a lot of I know best was for you, you poor thing. Let me help you through this, and my ideas are going to be better than yours. We got to reject that modality. And we got to start listening to the victims of what is going on and make sure that we understand what the effects of our reform efforts will be on these real human beings. Now, I want to thank the students for sensible drug policy. You all helped me a lot to understand what was going on in the student community about 15 years ago. And I got involved with Steve Silverman, who started a different organization. And we produced a film called The 10 Rules for Dealing with the Police. I urge all of you to distribute it. It's free. It's on the internet. The population of people who interact with the police have to see harm reduction by the manner in which we react to the wild animals with uniforms and badges. And so I want to thank you for that. I want to thank LEAP. You all turned me out to you and Jack Cole did a wonderful job getting me to legalizing all drugs. And I want to thank all of you for coming out tonight. This is a very important evening, and it's turned into an even more important evening because so many of you came out and expressed your interest on a Wednesday night. It's amazing to me. So thank you so much for listening to us and stimulating us with new and better ideas and approaches. We needed it, and we're going to keep doing this with you as long as you want us to.
Yeah. Appreciate it. we just want to wrap up. I mean, we could be here all night. I could stay here longer and ask questions, but you're gonna stick around now. So this concludes today's public forum. Thank you for coming.
Yeah, yeah, and we can answer some questions too.
Yes, I'm gonna let some people thank us and then I can feel good about myself. Right. Oh, yeah, thank you. Of course. I'm raising pitch during the reception.
Thanks. Yeah, I didn't want to do it up here, like the reception would be best. Just gonna talk about like your work to decriminalize trees and tell people to support us.
Yeah, that's great. Thank you. What's up? I do want one, but let's give him a minute. I don't think he's gonna put out. I mean, I think like he'll be understanding. Hey, Brian.